Say goodbye to endless reading. We've summarized all these textbooks, so you don't have to. Hit play and save time. Anatomy of the middle ear. Roof of the middle ear. Thin plate of bone called tegmen tympani separates the tympanic cavity from the dura of the middle cranial fossa. Extends posteriorly to form the roof of the aditus and antrum, formed from both the petrous and squamous portions of the temporal bone, with a suture line in between known as the petrosquamous suture line. Petrosquamous suture line, unossified in the young and closes in adult life, provides a route of access for infection into the extradural space in children. Veins from the tympanic cavity pass through this suture line to the superior petrosal sinus. Floor of the middle ear. Thin plate of bone, narrower than the roof of the middle ear cavity, separates the tympanic cavity from the jugular bulb. Thickness varies according to the height of the jugular fossa. Sometimes congenitally deficient, allowing the jugular bulb to project into the middle ear, separated only by fibrous tissue and mucosa. Tympanic canaliculus. Small opening at the junction of the floor and medial wall of the cavity. Allows the entry of the tympanic branch of the glossopharyngeal nerve, Jacobson's nerve, into the middle ear from its origin below the base of the skull. Anterior wall of the middle ear. The narrowest wall because the medial and lateral walls converge anteriorly. 5 openings perforate the anterior wall. Lower 1/3. Thin plate of bone covering the internal carotid artery as it enters the skull and before it turns anteriorly. Perforated by superior and inferior caroticotympanic nerves carrying sympathetic fibers to the tympanic plexus. Tympanic branches of the internal carotid artery. Middle 1/3. Perforated by upper opening for the canal of tensor tympani muscle, which runs along the medial wall of the tympanic cavity. Lower opening for the Eustachian tube. Upper 1/3. Pneumatized and may house the anterior epitympanic sinus. Epitympanic recess. Small niche anterior to the acicular heads. Can hide residual cholesteatoma in canal wall-up surgery. Posterior wall of the middle ear. Lies close to the mastoid air cells. Aditus. Opening through which the adic communicates with the antrum. Lies above the pyramid, near the junction with the roof of the middle ear. Fossa incutus. Small depression below the aditus. Houses. Short process of the incus. Short incutal ligament. Pyramid. Bony projection from the posterior wall with its apex pointing anteriorly. Below the fossa incutus. Contains the tendon of the stapedius muscle, which attaches to the neck and posterior crust of the stapes. Facial nerve. Runs in the posterior wall just behind the pyramid. Facial recess. Also called the posterior sinus, suprapyramidal recess. Depression in the posterior wall, lateral to the pyramid. Mounded. Medially by the vertical part of the facial nerve, laterally by the chorda tympani and tympanic annulus. Above by the fossa incutus. Surgically important as it provides direct access to the mesotympanum without disturbing the posterior canal wall up, or intact canal wall technique. Posterior cranial fossa and sigmoid sinus. Located posterior to the posterior wall. Medial wall of the middle ear. Separates the tympanic cavity from the internal ear. Promontory. Most prominent portion of the medial wall due to the basal coil of the cochlea. Has small grooves on its surface containing the nerves that form the tympanic plexus. Sometimes the groove containing the tympanic branch of the glossopharyngeal nerve, Jacobson's nerve, may be covered by bone, forming a small canal. Oval window, fenestra vestibuli. Located posterior and superior to the promontory. Connects the tympanic cavity with the vestibule. Closed by the foot plate of the stapes and its surrounding annular ligament. Lies at the bottom of a depression or niche known as the fossula, which varies in width depending on the position of the facial nerve superiorly and the prominence of the promontory inferiorly. Round window, fenestra cochlea. Lies inferior and posterior to the oval window niche. Round window niche is most commonly triangular in shape, with anterior, posterior superior, and posterior-inferior walls. Covered by the secondary tympanic membrane. Roughly oval in shape, made up of 3 layers. Outer mucosal, middle fibrous, and inner endothelial layer. Does not lie at the end of the scala tympani, but forms part of its floor. Curves towards the scala tympani of the basal coil of the cochlea, making it concave when viewed from the middle ear. The singular nerve, supplying the ampulla of the posterior SCC, runs 1 mm behind and parallel to the posterior portion of the membrane. serving as a landmark during surgical procedures like singular neurectomy for intractable BPPV. Facial nerve canal, fallopian canal, runs above the promontory, an oval window in an anterior-posterior direction. Behind the oval window, the facial canal starts to turn inferiorly as it begins its descent in the posterior wall of the tympanic cavity. Its bony covering may sometimes be congenitally dehiscent, exposing the nerve and making it vulnerable to injury or infection. Marked anteriorly by the processus cochleariformis, hook-like projection just anterior to the oval window. Tendon of the tensor tympani takes a turn here to attach to the neck of the malleus. Marks the level of the geniculate ganglion of the facial nerve, an important landmark for surgery. Cog process. Small bony bar anterior and superior to the cochleariform process, separating the anterior epitympanum from the rest of the attic. The facial nerve runs between the cog process and cochleariform process. The geniculate ganglion lies deep and medial to the cog. Sinus tympani, infrapyramidal recess. Most constant depression in the retrotympanic area. Posterior extension of the mesotympanum, lying deep to both the promontory and the pyramid. Facial nerve. Bounded by subiculum below. Punticulus above, arises from the promontory above the subiculum and runs to the pyramid on the posterior wall of the cavity. Can extend as far as 9 mm into the mastoid bone when measured from the tip of the pyramid. Importance: cholesteatoma extending here from the mesotympanum can be difficult to access, making it one of the most inaccessible sites in the middle ear. Lateral wall of the middle ear separates the middle ear from the external ear, formed mainly by the tympanic membrane, partly by the ring of bone into which this membrane is inserted. This ring of bone is incomplete at its upper part, forming a notch of Rivenus, tympanic membrane, semi-transparent, and forms a window into the middle ear. Possible to see some structures of the middle ear through the normal tympanic membrane, e.g., long process of the incus, incudostapedial joint, and the round window. Chorda tympani nerve enters the middle ear through the posterior canaliculus. Runs on the medial surface of the tympanic membrane between the handle of the malleus and the long process of the incus above the attachment of the tendon of the tensor tympani. Exits through the anterior canaliculus. Scutum. Thin bone portion easily eroded by cholesteatoma, leaving a telltale sign on a high-resolution coronal CT scan. 3 openings in the medial surface of the lateral wall. Posterior canaliculus. Situated at the junction of the lateral and posterior walls of the tympanic cavity, immediately behind the tympanic membrane. Leads to a bony canal that descends through the posterior wall of the tympanic cavity in front of the facial nerve canal, also known as the canal for the chorda tympani nerve. Petrotympanic, Glazerian, fissure. A small slit about 2 mm long, opening anteriorly just above the attachment of the tympanic membrane. Houses the anterior process of the malleus and transmits the anterior tympanic branch of the maxillary artery to the tympanic cavity. Canal of huge ear, anterior canaliculus. Lies medial to the petrotympanic fissure. The chorda tympani nerve leaves the tympanic cavity through this canal.